African American Wellness Project started in about 2002 because Flo Stroud, who I know you must remember, who was the director of health of both City of San Francisco, City of Berkeley, we were both pretty tired of the way African Americans were treated in the healthcare system. And so our objective was to put together an organization which assisted African Americans in dealing with the healthcare system, the so-called health disparities. Health disparities are interesting in the sense that they don't have to do with what you have because of who you are or who your clan is. They have to do with how the healthcare system treats you once you get into that system, because that's just as important as health and health outcomes as is health disparities. And so we put together a project that started from beginning to end in terms of talking about early detection, disease prevention, talking about how to set up your healthcare system, and then talking about how to respond to a system that does not respond to you. I always say that if African Americans got as mad about healthcare, which is poor in quality, unequal, as they do when somebody cuts in front of you in the Safeway line, we wouldn't have this problem. Everybody on this call, everybody on this podcast has had an experience as a Black person in the healthcare system where they felt unappreciated, disrespected, and poorly treated. And so we have focused on that throughout most of our career. At the present time, our executive director is Monique Pittman. We have all put together a number of projects that have to do with primarily with outreach. So we have basically several components. We have one component with blackdoctor.org, which is a Facebook Live program. You know, they have 3 million Facebook fans, so we're able to reach people there. We also have a podcast called Black Doctors Speak. We have a number of media projects. One is a second opinion program, which we're starting here in the Bay Area, where people can call and get second opinion. We feature Dr. Glenda Newell, who has written a book called Focus on Your Better Health, which talks about how you set up your healthcare system. And we have a number of other more robust kinds of ways to reach the community. At the present time, we really have the potential probably to reach 100,000 African Americans through all of the various partnerships that we have, primarily with obviously Zoom, StreamYard, and the other ways to do it. But I'm convinced that communication has changed. I'm sure you feel the same way. And so that to be able to reach that number of people with a message is important. We have been, as you know, on KBLX for almost 25 years, with 30-second and 60-second up to the date, trusted, vetted, timely information to approximately 220,000 African Americans. So we've been doing this for a very long time. And so my background is both in allergy and asthma, but I was also the medical editor for CBS Radio for 15 years, Pacifica Radio for 15. So we've had a lot of communication experience. But fortunately, with people with a new communication, people like you, African Americans, can get good information easily. And I'm so proud of the work that you've done through the years, because Alzheimer's is not an easy thing to approach.
Well, I really thank you for that. And I think as a community, we are all trying to come together and educate not, our brown and Black siblings, but also everybody on this. But in order to change the system, it takes a collective process to do that. And it starts with how we educate our medical professionals.